think we need to start focusing on what matters. We need to focus on jobs. We need to focus on expanding rural broadband, which has a healthcare component to it. We need to increase rural healthcare access or any of the other issues that really matter to Iowa families and to all Americans. I do remain committed to making improvements to the ACA. I voted for some of those improvements in the past, but this bill is not going to go in that direction. It will go in the opposite direction. And one last point on rural areas. I represent a rural part of America, and I'm proud to represent that part of America. But I'm concerned that this legislation does little to nothing to help those in rural areas. We must ensure that our nation's health care policy works for all Americans. Too often we see folks in rural areas, including much of the state of Iowa, denied access to quality medical services. With nearly 1 in 5 uninsured Americans living in rural America, it is imperative that any policy put forth positively affects rural America. A few weeks ago when I was home over the weekend, I visited a number of rural hospitals and I asked them how they anticipate the ACA is going to affect them. The fact of the matter is it's going to affect them very negatively because over the years since the ACA, they've been able to reduce the amount of charity care that they have to accept. And this is going to be a problem because it will affect their bottom lines, and ultimately it's going to affect the availability of health care in these hospitals for those folks in my part of the world, in that part of Iowa, in those rural parts of Iowa. What I've got, if I may, Mr. Chair, I want, with unanimous consent, I request that I put into the record a statement from the Iowa Hospital Association.
Without objection.
Thank you. And I'm just going to read a couple of parts of that very quickly. The title is ACA Replacement Would Be Harmful to Iowans. And basically what they're saying here is Americans are getting their first close look at a congressional proposal to replace the Federal Affordable Care Act, also known as Obamacare. There's a lot to pore over. First and most overriding concern from the hospital perspective is that access to health care through safety net providers does not equal coverage. And coverage is essential to good health, a strong health care delivery system, and reduced health care costs. This proposal threatens to both reduce coverage and access for poor, elderly, and disabled Iowans, making it a significant step backward from the current law. There's more in here. Thank you for letting me submit it to the record.